Hi, team. I see we are joining the 11 of us. We will give ourselves just another few minutes. We start. So, yeah, I seem quite dark, but I can't seem to get any brighter. So we'll just carry on. Good evening, everyone. I hope you've had a good week. I know it's still hard work trying to balance all these many things. But as you can see from what you are learning, it is worth your time, I believe. Today we actually have two guest speakers um, who I will introduce in just a few minutes. But I just wanted us to touch bases if there are any burning comments around the coursework, the quizzes, the ILP, and so forth. If there are any specific issues which you'd wish to share before we invite our guests to speak to us. Anyone with any comments or issue to raise? I know you've had the last 2 weeks or so, conflict management, change. They are very tangible things which I think we experience every day where we work. So if there is anybody with anything to share or to any comments, the floor is open. Miteya is what happens if one fails to submit ILP before deadline and then we are closed. Okay. I believe from previous experience, the ILPs don't get closed until after the 7th week. Unless things have changed, that's the way it should be. You just do your ILP, but submission can be delayed up to the 7th week when you do the last ILP. I can counter check, but that has been the situation in the past. It's the quizzes which get closed after the second week, but the ILP submission does not close. And how about discussions? Please confirm about ILP. I will confirm about ILP, the same as discussions, because some of those submissions take a bit of time. And in the beginning, in the general information, there was some discussion around when everything should be submitted. But I'll counter check and share on our wall. Any other comment? Okay. Okay, there is one. Okay, thank you, Dr. Mitei. We will now proceed with our next part of this presentation today. Today we have Dr. Gregory Nganda, who you know very well, and also Dr. Mangrit Jenga, whom I will introduce later. I invited these two leaders who are in different environments to come and share their experiences with you so that you get real time. People who are actually sitting in those positions and having all those different problems you are reading about or you are learning, so that you know for sure what you are learning will be translated into real issues when you get on the ground. So without further ado, I'll start with Dr. Nganda, whom you all know is one of us, is an obstetrician gynecologist, but he's been a CEC in Kisumu County. CEC is the County Executive Committee member for health. I think this could be his second term or so, he can confirm. But apart from that, he's, I think, currently chairing the caucus of the CECs. So he's like the convener of all the CECs from the 47 counties. I asked him just to come and share. He doesn't have to make any presentation, but just to give us, to give his fellow obstetrician gynecologists a feel of how or what it is that one does in the county as a CEC and some of the issues which I'm sure you raise in your hospitals, which the CECs need to take cognizant of. So without further ado, Dr. Nganda, can I request you to have the floor?
Yes, thank you very much, Dr. Kibaru. As she's told you, my name's Ganda, Dr. Ganda. I work in Kisumu. I'm the CCM for Kisumu. I've been in leadership for quite some time, and thank you very much for the opportunity to talk to you. I was told I was going to speak to a very young gynecologist, but I see there's a good mix of people here, people who have learned from also, and people who have also learned from me. And so I hope we'll have a very good discussion. If I was to speak about leadership, I would speak for a very, very long time over my experiences over the many years from the time I started as a med soup in the smallest hospital in the middle of nowhere called Ngao, to where I am right now as a CEC. I've risen all through those ranks and learned so many things that I can share. But today I'll just pick one or two things that I think are important that we could reflect on, and I'll be available for questions after that because I'm told I have like 10 or 15 minutes to talk. So first, I want to say that everybody is a leader. And leaders are not people sitting in an office somewhere. You can be a leader because of your position, administrative position. Like I'm a leader right now because I sit as the in charge or the head of the Department of Health in Kisumu. However, you can be a leader when you are sitting in your clinic because you have a duty as a gynecologist or as a specialist where you are to the patient and to the patients. Because whatever you want to do, whatever you are doing on that one patient needs to be learned and needs to be shared across for other people to learn. But then you have a duty also to make sure that patients like those don't come to you. That's why you do cervical cancer screening. you could as well wait for cervical cancers only and treat them. So that makes you a leader. You are sometimes called to go and speak to students. People listen to you. Your WhatsApp or comment on Facebook or social media is taken seriously. And that is all leadership. So I start with my reflection in Migori when I was a gynecologist. When I completed my obs and gyna, I was first posted to some place in Homa Bay, and I declined because I wanted to work. So then the Dr. Lucy decided that no, you go to Migori and you'll be a med sup or you'll be a DMSO, but you'll be a gynecologist. And I was a very serious clinician by then. I spent hours in theater. I was the only gynecologist, so I would work quite a bit of time, and I had very few medical officers. Sometimes I would release all of them and just run the whole hospital because they would get tired. I remember I missed my whole graduation because of that. We had so many cases of defilement, young girls who had bad perineal tears and all that. And I spent a lot of times. I would wake up, if you called me at 2 a.m. with a young girl who has bad injuries, I would go there. I would go to court, I would do everything. But then, after a number of years, when I became a director, one surgeon was discussing with me and Abad, he told me that you guys keep saying that you're working very hard, but your maternal mortality is very high. And then I brushed him aside. I said, you don't know what you're talking about. But then when I became a director, my first meeting was in Nairobi with UNICEF. So I was called because we were going to do a proposal. And I walked into the room, I realized everyone was an Oria, somebody from Northeastern, and I was wondering how comes. So then I heard there was something called ASAL plus one. ASAL plus one means arid, semi-arid areas plus one. One was Migori, because we had the highest maternal mortalities closer to the ASAL. And so we were grouped together to try and reduce the maternal mortality of our regions. And yet I had been working very, very hard for 3 years. And that's one of the first lessons you learn in this game, is that as an obstetrician, you have been trained to save lives. But the most difficult realization you will have is that when you walk into this public health space, the outcomes will be determined long before that patient reaches your table. That means that for you to make any impact, you will have to do a lot of things away from where you are. And that is where leadership comes from. So you are a leader even as a clinician in the facility. And I like the story of Omoi teaching at referral hospital, that the gynocs work all the way up to Kisumu to do cervical cancer screening. Yet they are trained to do radical hysterectomies and those complex things. So the first lesson for me is that systems will save more lives than your individual heroics. However good you are, a fantastic surgeon, if those systems are not well coordinated, you will have very little impact. That's the difference between the public health guys and the pure clinical people. And I really try to make sure that the clinical people start seeing things from a public health angle. We argue a lot in the page, the obstetricians page, where sometimes I give very controversial opinions and people really want to fight me because they all have, most of us, we are trained to have that clinical angle. The second thing is the issue of financing. That when you enter into leadership, you will determine a lot about how much money goes where. Not directly, not by sitting down in a committee or something like that, but by the policy you make determines where the money will go. Every year, we have to do a fiscal strategy paper. It's a one-page document, but that one-page document determines where the money will go. But before you do the fiscal strategy paper, there's something called the budget ceiling, that there are some people in finance who will decide that this is the ceiling for the Department of Health. Now, as a leader, you will have to work within that ceiling. And that is where you learn that clinical guidance are not enough for you to have any impact. And this is something that I feel very strongly about. that many times you're going to balance between what is best for the population vis-a-vis what's best for the patient in front of you. You hear us arguing a lot about HPV screening. Why can't we make HPV be available in SHA? SHA should pay for everything. Why not? They should pay for HPV, they should pay for, they should pay. But the truth is, the money is not going to be enough. And that is when now you shift into public health thinking. And I try to tell people it's like having a road traffic accident. I used to work in Voi, where you would get an RTA, and then 3 buses got an RTA, and you are the only doctor available. Now, you could save each of these people if you had time, but the truth is you don't have time for all of them. I remember one time having to decide that I'm not going to spend more than 1 minute on you. If I can't fix your line within 30, 45 seconds, I leave you. I go to the next person. Chances are they will die. Chances are I would have saved you, but I have to make decisions that saves the highest number of people. Now, that is where your leadership comes in, because you have this epitome, you have this ceiling, and then you have to decide what works best for the majority of the people. And this is what I do a lot of times. I have to make decisions on do this or don't do that. In my first year as a CEC, I had to make a decision on community health, something that people don't take very seriously. I remember I had a budget of around 200 million shillings for medications every year, and my ceiling didn't change. So I slashed 110 million and decided I'm going to pump it into community health. And that year, CEOs were on strike. There were so many things. I was in the newspaper, Akuna Dawa. It was not a very good experience. But 2 years later, we had cut mortality by 30%. All right. So it was painful that patients had to go out to buy medication. They had to go out and buy several things. But the impact was felt 2 years later. Okay. A 30% reduction in mortality, something that we had never done ever. So that's where leadership comes in. Leadership comes in that you have to make decisions that favor majority, but some people will lose lives. That is how it is. Too bad. The clinician wants to save everybody, but the public health guy wants to save the majority. So let 10 trees die, but let me save 90 of them. So very difficult decisions to make sometimes when you have a clinical mind. But when you have all these things in front of you, then you have to make that decision. Last but not least, leadership is about alignment. The biggest thing I do as a CEC is aligning people. That's all I do. Making sure that the political guys, the clinical guys, and the wananchi are aligned. It is the most difficult part of that game. And it will always be give and take. You have to give for you to get. If you don't align, you don't succeed. So one of the strategies I did when I learned that this is the alignment, it took me 1 year to learn what political thing was all about. I had a retreat with all my MCAs, each of them 4 days in a hotel, 2 days of relaxing, 2 days of talking. My first retreat was the governor. 1 day, just talking about what he wanted, and me telling him what I thought we should do, and us agreeing on what the vision is for the next 5 years, so that everybody knows that these are the expectations, and we wrote them down and agreed. Then I went to the MCS, I listened to them, but I learned a lot from them. You think they are very stupid guys? They also have a lot of expectations from Wananchi. They changed a lot of my thinking on many of the things I wanted to do. So then you align them. Again, it is give and take. What do you want to do? This is what I think should be done. All of us have the same amount of money. I have a development budget of 200 million. I have to give 80 million shillings to take care of their demands. And then they have to allow me to 120. So up to now, my budgets walk in to assembly and they walk out the way they were, because I've taken care of everybody's interest. This is pure politics, and this is how it is done. Sometimes you will have to allow money to go to a place which you think is useless, but because you need that vote and you need alignment. So For as long as you're making steps moving forward, you are okay. So that managing expectations, managing people is the biggest thing about leadership. And so even if people make a lot of noise, you say just so be it, because that is the way it is. The world is not exactly the way you think it is. Last but not least is the big picture. Always look at the big picture when you are a leader, not the small picture. Always look at what is the outcome. You know, I look at SHA. Yesterday I was talking to somebody about SHA. And when people are seeing cancer treatment and people are seeing dialysis guys walking away, I'm seeing something totally different. I'm seeing something primary healthcare. I'm seeing the amount of money going to my level 2 and 3 facilities doubling or tripling. I'm seeing medicine availability in level 2 and 3 facilities much more. So I see the bigger picture and I don't bedevil on the smaller picture. The big picture is what the leader sees. He accepts that, yes, there'll be noise, yes, there'll be A, B, C, D, but I have to keep on moving forward. You accept that people will make mistakes and they will always make those mistakes and you have to move forward. And the final thing is there are always people working against you. Even the people you think are your friends, there's a lot of backstabbing in leadership. I've learned several painful lessons. People very close to you who you think are with their agenda, they have their own agendas. You have the agenda, they have their own. They're working together with you, not because they want to achieve what you want to achieve, they want to achieve their ends. And when that is not met, you find things just don't move. You want to procure, if I had time, I'll talk about our cancer center and how frustrated we've gotten from people who are very, very close to us. So then you realize that you must expect it. You see what the Railas went through. You've seen what Ruto has gone through. You've seen what Uhuru has gone through. It is part of the leadership. So my final reflection, don't solve the problem. Solve or build a system that solves the problem. I tell this to my gynecologists, to the doctors who are around me, the specialists. I spend a lot of time trying to convince them. Do not spend your time, 100% of your time, walking into the clinic and walking out. The determinants or the outcomes of what you're doing is determined way before and outside. You need to look outward first and solve that system outside before you look inward. Yes, do your radical hysterectomy, but go into that community to do screening. Otherwise, then your outcomes will continue being poor. And you always wonder why, where we have highest gynecologist concentration, there is no difference in maternal mortality. For very many years, there is no difference between Kisumu and Homa Bay. And Nairobi has had the highest mortalities, yet the highest concentration of gynecologists. It is just the paradox of life that there is much more to it than what you do inside that clinic. And where you have lower level people, more of them, the clinical officers, the doctors, the young medical officers, and fewer consultants, you are more likely to get better outcomes because the other medical officers look outward, the clinical officers look outwards, the consultants look inward. Call me when there's a problem, not anticipate and try and deal with problems before they become problems. So you have a you have a ruptured uterus, call me, I will do the subtotal hysterectomy. But why is it that you're getting obstructed labor? Why are you not going down there to ask, are you guys filling the photograph? Do you understand how the photograph is filled? That is what will make the difference when you're a leader. Thank you very much.
Thank you very much, Dr. Gada, for those very succinct comments. I think our participants, the gynecologists who are online, they will have a chance to engage you in just a few minutes. So, guys, hold your horses. I can see fingers going up. Yes, and mauas, everything. Let's have our second
Asante.
speaker. Our second speaker. Then keep your questions. Then we'll ask both of them so that you can direct to whoever you wish to respond to you. Our next speaker is Dr. Mangrit Jenga. Dr. Njenga is a public health expert. She's a medical doctor with public health who works as a CEO of Population Services Kenya. Margaret has worked in the public sector, in the faith-based, in the NGO, from program work to the current position where she is a CEO at PS Kenya. Margaret, over to you. Speak to these obstetrician gynecologists who are leaders in their own rights, but aspiring to do better. That's why they are doing this course, which is transforming leadership skills under the Washington University. Over to you, Margaret.
Thank you so much, Dr. Kibaru, for that introduction. And it's such an honor to speak to this group of distinguished doctors, and also after Dr. Ganda, who I know I've had him speak severally in a number of forums, conferences, and it's exciting to be part of this session. I'm really happy. First of all, I take this opportunity to congratulate you for taking up this course, because you are in the right place, and this is the future of the health system. It really depends on leaders like you who step forward, not only as experts in medicine, but also as experts of systems. Dr. Ganda has really emphasized the systems component, which is very important in this discussion, or creating change at a high level. Over the past 17 years, I've had the privilege of working in the non-governmental sector, particularly also in reproductive health. And this role, working in the NGO space, has given me an opportunity to observe many actors in the health space, and how the different stakeholders are aligned, the different interests, and how all these interests come together to work towards helping the patients, and all the conflict that arises towards all that, as all that is happening. And much of the work that I have done has really involved strengthening these health systems, trying to expand access to life-saving products. For example, in PS Kenya, we have health products in the market, and also working with governments at policy level, at the national level, at county level, in strategic planning, annual work planning, budgeting, and supporting at the higher level to improve health outcomes. Also, part of the work has been working with development partners who surprisingly really understand the strategies that we have in these countries, in this country. And also working in environments where resources are very, very limited, which I believe is a lot of the areas where most of you are currently working, but the needs are enormous, very, very huge. So today I'd want to share some of the lessons from the NGO sector that I believe are particularly relevant to all of you, as you continue leading and as you work towards improving health outcomes. I begin with a story of how I was posted years ago. Early in my career, I was a young doctor, just graduated. I was posted to Nakuru. Thereafter, I was posted to Gilgil. Very decent facilities, not extremely rural. But while there, and particularly in the Nakuru, now County Referral Hospital, there's a young mother who was referred with postpartum hemorrhage. I was there. There was the obstetrician and gynecology specialists like you who were there. There were nurses. And when this lady came, she had bled extensively. It was a late referral. We tried all we can. There was no blood to transfuse this lady. And that really woke me up, because we had the skills. We knew what we needed to do, but there were no supplies in that. And that really frustrated me, because I saw the pains of the healthcare system and how it has failed the patient. And that situation has not changed much. From, let me say, 18 years ago to date, it's the same pains that we see in this particular health system. And that moment stays with me. Even in the work that I do in public health, I realize that clinical excellence can saves lives. It saves lives. However, leadership determines whether systems can save millions of lives. Instead of saving one life while dealing with systems, even much more lives can be saved. And leadership, to my first lesson, I'll share my screen. Let me get that so that you can see. It's coming up shortly. I hope you can see my screen in slide mode. Is that correct?
Yes, we can, Margaret.
Great, thank you. So I'll take you to the first lesson on what global health teaches us about leadership. That trust is the foundation. Trust is everything. Patients trust you with their lives. Communities, our people, really trust health systems to protect them. And teams trust leaders like you. All of you are leaders, and teams trust you to guide them. The minute you have that title, doctor, and to add on to you what you have as a specialist, as OBS gynecologist, you're very, very strong leaders. In the NGO sector, trust is the difference between a successful program and one that really can fail. For example, when introducing a reproductive health program in some communities, we get a lot of resistance because knowledge levels are very different. There's also a lot of myths and misconceptions on the work that we do on reproductive health. And this resistance can be very difficult to change unless there is trust. Once we build trust, then communities now see that the work that we are doing has the best interests for them. Technical expertise alone cannot change our mindsets. What changes people is trust. And this trust is built through transparency, being very open, respect, and very honest communication. I've seen programs that have failed because leaders tried to push solutions without listening to what the people want, without getting people to feel heard. And I've also seen work that has excelled because leaders take time to understand what the needs of the community are, answer difficult questions, communicate openly. When resources are not enough, say that openly as it is. Therefore, leadership lesson number one is very, very simple, that trust moves systems more than authority. Even with the strong titles, if the community or if people or if patients don't trust us, then that cannot really save lives. And looking at clinicians, this therefore means that communication becomes a very important skill, that communication is an important skill as a clinical skill, because clinical skill saves one patient. But for you to move systems, communication skills need to be much more enhanced. You need to listen more and also to communicate points very, very clearly, explaining decisions clearly, showing people why the system is failing and where we need to go and how we are going to get there. And while saying that, pushing through, but getting the clients or the stakeholders, if it's the government or the development partners or communities, getting them to feel heard, listening to their interests, and also meeting them based on their needs. And one thing that is very difficult for doctors is to say that I don't know. And that becomes it's difficult to build trust when we claim to know what we don't know. Therefore, just opening up and saying, I don't have the answer yet, but we're going to figure it out together. That builds trust so that the stakeholders really see us as human beings. And also integrity and transparency. These become very strong leadership tools. They're not just ethical values. It's a key point in building trust. On the second point is on health impact, is that it is a team sport. It's no longer about individuals. And really, clinical expertise is about moving from individual expertise to collective performance, where in leadership, it's more about what the team has delivered, not what I have delivered. In clinical practice, we heavily depend on individual skills. In leadership, success really depends on how well the team functions. Even in our in our own absence, how well is that team delivering? How well are others delivering in our absence? In PS Kenya, we work also with different people, supply chain specialists, public health experts, community health volunteers. And sometimes it really surprises me when clinicians or people who are very, very senior in the clinical space don't understand what community health promoters are doing or community health volunteers are doing. And when you get to the political leaders, some of them know this extremely well. They put their money behind community health volunteers, community health promoters, because they know the impact of this, the impact of that particular work. And knowing that health impact is a team sport is that there's no one stakeholder who can solve all these problems. The problems are many, it's a health system problems, and real impact is going to happen only when all this diverse team comes together to work effectively. Strong teams always outperform different individuals. And our leaders, as leaders, our job is really not to be the smartest person in the room. And our job is to create an environment where the team can do its best work, where people can have psychological safety, they can be free, they can say what they want to say towards improving our systems. Our teams can speak openly and come together and align towards a shared mission. So that as leaders, we ask ourselves, instead of asking, did I solve the problem? The question becomes, did the team solve the problem? And that is winning in leadership, when others are able to do and others are able to deliver on key works or key indicators as needed. I want to talk about conflict. Conflict is very normal in leadership. It is one thing that cannot be avoided. And healthy conflict is very constructive. You'll find that better decisions, better results are reached when there's healthy conflict. When there's conflict, it shows that the stakeholders want to engage. They want to either understand better, they have a different point of view, they have different interests, their incentives are different. And therefore, as a leader, it is important to listen to what is being said beneath the conflict, because conflict shows that either there is fear or they feel unheard, some needs are not being met, but just listening deeply about what is this conflict about. When different people meet different perspectives, conflict is inevitable, and it is not necessarily a problem as well. Therefore, what leaders need to do is really to hold the tension and guide people towards a common ground, listening to all the different stakeholders and guiding people towards that North Star, the direction that we are all working towards. Healthcare is changing very rapidly with all this, what you're seeing in our country. Change is inevitable. It's something that will always be consistent. And what you'll realize is that people can truly handle change. If change is communicated to them, they will handle it. What people struggle with is uncertainty without guidance. When there's no guidance, people hesitate, they don't step up, they don't support the initiatives because they don't understand why these changes are happening. But once there's communication, it becomes much easier for people to buy in. Remember the psychological safety, speak openly about their fears, what they're not understanding about the change, and also to step up as well. As I close this conversation, I invite you to reflect about yourself as a leader. Your clinical expertise is a superpower. It is a very strong superpower as a clinical leader. The minute you show up and speak in an audience, you bring a lot of credibility because of the frontline work that you've done, seeing patients on a day-to-day basis, managing very difficult cases, working in very remote areas. And it's very important to speak up as a leader. And as you speak up, remember that clinical expertise alone will not change or create large-scale impact. It's bringing the systems thinking, transforming fragmented care pathways into coherent, high impact delivery. Therefore, your leadership really multiplies when you step at a higher level, seeing how the different systems are working, how policies have been put in place, what policies are these, there are international commitments that this country has made. How does that affect the resource allocation? And what can you do about it? How do you step up? How do you ask different questions? How do you ask when you're not sure? And there's nothing wrong with asking. And I thank you because you're really moving, or you've already moved from saving individual lives, which is really extraordinary, to shaping entire systems that improve the health of entire populations. This is not an easy thing, so congratulations. Conflict will be inevitable. Again, it is part of life, and I thank you for taking your time to listen to me this evening. Thank you, and back to you, Dr. Kibaru.
Thank you very much, Margaret, for provoking our thinking. I believe, colleagues, you've heard from those two people who are in leadership positions from the two different sectors, but they all gravitate towards systems thinking. They were not even, they didn't even know they were both coming online today. So they prepared their thinking in their own way. But you can see the whole discussion is around systems thinking, involving people, building trust. You want Dr. Gada saying he sat with those MCAs, whom sometimes we call cancerous, just to spite them, but you need them because they are the ones passing the budget. And he explained how, because of all that, his budget is never an issue. Yeah, Margaret takes care of many people in PSK. They produce all those trust condom and other things which have to get to the market and get sold so that the NGO does well. So all issues around conflicts and change, and I know I think towards the end of the year, they're under new product, and getting to involve people into getting that product in the market. So without further ado, I will open the floor so that you engage with these two great people who are agreeing to speak to us this evening. So you can either put your hand.
Sorry, Dr. Kibaru, you're muted.
Yeah, I muted myself to allow you to talk.
Thank you.
Yeah, so guys, your comments, even complimenting them for spending this time with us to show us that we can also be leaders. Those high places. I'm sure you didn't hear the last bit of it. Any hand? Dr. Gigondu, you don't want to say anything today?
Igondo can only share experience. I think he has also a lot of experience in leadership.
Yes, he should. Dr. Kigondu?
Yeah,
You can't
thank
get
you.
away with it.
I was going to keep quiet today. Thank you very much. And I think the two presenters that you have selected for us today are excellent presenters. And they are an example of what leadership is in this country. I'm sure they are surprised we are still doing leadership courses, but yeah, I think we need to continue increasing our knowledge in leadership. So, starting with Dr. Ganda, I think Dr. Ganda, like me, so to speak, has had the full round of experience, which is an experience that
Is it my internet or his?
Dr. Gigondo, your internet is really
a lot
letting you down. Dr. Gigondo, maybe you need to do something about your internet. We have lost you. Dr. Kigondo, can you hear me? Yeah, I think you need to move a bit or sort out a little bit on your internet because we are not able to hear you. I see two comments here appreciating Dr. Nganda and Dr. Njenga for taking time to share. This is from Mary Njuguna. We thank you for those comments. Anybody else willing to share anything with our speakers? Any query? I see Dr. Rahab Mudon, you are med soup in a level 4 hospital. Do you wish to ask Dr. Nganda any question or any comments you have? Dr. Rahab? Dr. Mudhoni Rehab, unmute yourself if you can. I hope I'm not muting everybody because it's so quiet. Dr. Kasemberi? Today is really quiet in this war of ours.
Am I audible?
You are still pouring. I think there's a big problem with the internet on your side, Dr.
Hello, this is Kasembeli.
Yes,
I
Kasemberi.
think you see what Ganda and Njenga have talked. These are just basically realities we undergo daily with at a personal level. And then when you work in the public sector, these basically are the realities. Basically, they have talked about change management, how one should adjust and how to handle that, and the issue of the psychological safety, neutral zones and all that. It has actually reflected very well, and it's going very well with what we are learning. Thank you.
Thank you, Dr. Kasemberi. Anybody else have any comment to make or even a general issue related to your learning and this what they have shared today? Dr. Odiek, are you the one from Rondwa or where are you from?
I'm from Nairobi.
Oh, sorry. You have any comments?
Yeah, just appreciating Dr. Ganda and Dr. Njenga. I really appreciated. I know Ganda after Ngao we shared the yeah, it's good to just hear a lot. I know leadership is usually quite a challenge, and at times I liked the alignment bit, especially when you find yourself wanting to achieve something and you really have to, in terms of the give and take, it's a reality. Without giving in to some aspects, you cannot be able to move forward, especially when you're trying to convince people that this is the right, even at times doing the right, them to do the right thing according to you, or a high impact intervention. So I really liked the presentation. And also the second aspect was on conflict. Yeah, it's usually a big problem, and like the course, yeah, it's my second time taking it, and every time I take it, it's I learn something new. Thank you.
Thank you, Dr. Odiek. Yeah, and Dr. Ali Noor says they appreciate the two presenters, very insightful, thought-provoking, especially around systems thinking approach. Stella Njenga, great hearing real live application of what they are learning from both Dr. Anganda and Dr. Njenga. So, colleagues, we are moving towards closure. I don't plan to keep you beyond 8:30 unless it's something else. I think we'll digest what we have learned from those leaders. I take this opportunity to really appreciate Dr. Nganda and Dr. Njenga for finding time to be with us here from 7:30 up to now. And really, giving us insights, real life insights of what it is being out there as a leader. So, ladies and gentlemen, we will be coming to a close. But keep up on the timelines, especially quizzes. You know, it is 70% pass mark. And we are moving towards the interesting part of presentation by I think the 9th or so week. We should be thinking around what you're going to be presenting, because we will be presenting to each other and critiquing each other before you upload into the Washington platform, because that is what is expected for a site team to be able to listen to each other and critique the presentation. So I believe we are moving towards there. And yeah, we have more thank yous and compliments. And I also appreciate you, team, having worked the whole day. I'm sure you've done your normal things, your family things, homeworks, and all that. But here you are, trying to learn more on leadership, because we cannot do without it. As Margaret said, even just the fact that we are the clinicians, we are already super leaders. So let us keep that up and do the best we can to make sure that we are leading the teams in whichever places we are. So thank you very much, and do have a good evening. Thank you, Dr. Njenga and Dr. Ganda, for really taking your time to be with us today. Guys, we'll meet again, I think, after 2 weeks. We will post on the wall. I will share Margaret's presentation on our WhatsApp, so that maybe one can have one or two insights from the presentation. But I asked Dr. Gada not to prepare intentionally, ndio atuongereshe. Right. That's it. Good night and God bless.
All right, good
Good
night.
night. Nice, thank you.